One day I was at work and my cell phone rang, and I answered the phone, and David Goldberg from Penn was on the other side of the line.
I did get a call from Dr. Goldberg. The funny thing is, at first I thought it was like a prank call. I got on the transplant list in October 2014.
The doctors also said that if I were to find a donor and go for kidney transplant prior to dialysis, that would be the ideal situation.
I think because of my blood type, I wasn't going to see a transplant for 5+ years.
What we learned is that there are hundreds of kidneys from people with hepatitis C that are donated, but they're never used. They're literally discarded. So this study brings those kidneys to people who need it. We're doing transplants that were never done before. We're giving people hepatitis C with a transplant and then trying to cure them afterwards. So we chose people who had many years of waiting time ahead, people who were already on dialysis. And then the third piece of it is that we were really insistent on choosing people who could go through an intense informed consent process.
So once I got the material, I just read through it. I gave it to my son, my daughter, my friend, my sister, so they can all read it, so I can get their impression, their thoughts on it.
So the theory is that if I were to receive a Hep C kidney and develop Hep C myself, then they have a plan to treat me with Zepatier and be able to cure my disease.
People have to opt in to get a hepatitis C positive kidney. And so what happened at our center was that we brought these people in for multiple visits with a lot of education. After all of that and an extensive informed consent process, then we could check the box and they could get those offers.
My son looked at me and said, "Mom, this is a no-brainer," very clear. My daughter said the same thing.
When I first enrolled and they told me that the transplant would be quick, I was actually hoping that he'll just say maybe a year or 2 years. To my surprise, he said it'll be a few weeks to a few months.
Performing transplants is really just a wonderful opportunity to improve people's lives. We take care of individuals who come to us who are incredibly sick, whose lives have been devastated by end organ disease. In particular, patients with end-stage renal disease on dialysis usually can't work. It's a large burden on their families, and so the opportunity to perform a transplant successfully is incredibly meaningful because you can turn around someone's life.
When patients get transplanted, we're checking their blood to see if they have detectable hepatitis C on post-transplant day 2 or 3. One of the unknowns is, will every patient develop hepatitis C?
So I did get the disease. They told me this the day after surgery, and they started me on the medication. That Friday, it went down dramatically. I couldn't believe it. And the following week, it was completely gone.
So once they have detectable hepatitis C in their blood, we're treating them with a medication called Zepatier, which is 1 pill a day for 3 to 4 months. That is along with all of their standard post-transplant medications, which are not altered in any way. Among the general population, Zepatier cures more than 95% of people with chronic hepatitis C.
We estimate that there will be somewhere between 400 to 1,000 additional kidney transplants from hepatitis C positive donors if this trial is successful.
I'm looking forward to traveling with my grandkids, spending more time with the kids, go back to the things that I enjoy doing.
And she was just so excited about that simple pleasure that we all take for granted, and it was so gratifying to hear that.
Now that I have energy, I'll be picking up playing tabla, the Indian drums again. I'm also a gym rat. I go to gym every day. I want to get back into that routine, so now I'm feeling confident after the transplant surgery that I'll be able to do all that.
What's been really gratifying is that with Irma and some of our earliest experiences, that they've responded to therapy right away.
They've given me my life back.
All these doctors and plus the nurses, they were phenomenal. They changed my life.